Well, good morning. Hope you're having a great start to your day. Welcome to another live this morning as we do question and answer. Okay, here we go. Elise, you are first up. Rosalinda, a close second. Brahim, number 3. Bev, good morning. Mary, and nice to have you on. Jeanette from our staff. Hello, Jeanette. Wendy, good morning. Bernice and Kevin, Oshawa, Nativity. We got some great questions, guys. Pauline and Dorita from Manitoba. Wendy from Markham. Good morning, Wendy. Dan, how are you? Rachel and Bernice. Zian and Jean, good morning. Debbie, good morning. Madeleine, good morning. Deborah from Timmins. Pauline, Jeanette, and Natalie. Annette, thank you for inviting me into your home. Kristen, nice to have you on. Helena and Sharon, good morning. Pauline, you guys are great. We appreciate it. Micheline, Catherine, Springdale, Newfoundland. Solange, bonjour. John, Phyllis, Northwest Tennessee. Did you guys, Phyllis, get hit by that tornado last week? Francis, Alicia, Rhonda, we were praying for you guys. Karen, Lenora, and Jacques from Nouveau Brunswick, good morning. Luella, Tennessee. Michelle, Sharon, and Natalie. Okay. Marin, much appreciated. Suzanne, Helen. Okay, Lise, here we go. Let's get to these questions, and then the first question is from Gloria. What is IGF-1, sorry, and is that bad if it's in meat? Well, IGF-1 is a growth hormone. And is it bad if it's in meat? Well, if they feed it to the cows, look, I got to make a general statement, and I think it's important that you understand, Gloria, and anybody else listening to me. You and I no longer live in a perfect world, okay? We just don't. And whether it's meat or fruits and vegetables or whatever, almost everything is tainted today. Now, you can get truly organic, grass-fed, and I want all of that. But I don't talk about that so much, and the reason is this. I might have told you this story before, but actually this is a true story. A patient came to see me. It's got to be, 7-8 years ago. And she told me she was moving to Costa Rica. And she actually had a little place on an island, it seems like all by herself. Not quite, but, and she was getting away from North America and, and she looked at me like, and I said something, I said to her, it sucks to be the rest of us. And she looks at me like, I said, gee, how many people can just run away and live on their own island? No, when I talk, Gloria, I am going out to the masses, okay? In a week, we get 50,000, at least in a week, views of this live, and another 50,000 or so podcasts in a week. I'm talking to the general population, and the first thing is, and I use the illustration, don't worry about the deck chairs on the Titanic. If metabolically you're in that 88%, turn the ship before you hit the iceberg. Okay? And the reason I say that is because I am big on EMC, eggs, meat, and cheese. If you do that, and better organic, better grass-fed, better, of course. But we live in a world like vegetables are sprayed, fruits are sprayed. Try and do everything you can. But there's plastic they're finding plastic on Mount Everest at the highest peak in the world and in the placenta of babies. I just don't think we can get away from it. I wish we could. I'd like to undo it. But, when people tell me, I never eat anything that's got anything in it. Okay, well, good for you. And good for you if you can do it. But I speak in generalities. If you want to be healthy, the biggest thing you got to worry about is what you put in your mouth every day. And meat, any meat, is better than sugar. Any meat is better than sugar. Eggs. We discussed it earlier this week. It's a superfood. And so is cheese. It's a superfood. And there are better quality of eggs. There's better quality of meat. There's better quality of cheese. But I speak in generalities. So look, I want you to be aware of things, and I'm not against that. I'm 100% for it. But you have to understand that I don't want to make getting better so complicated that I won't eat anything because it's maybe tainted. Yeah, maybe tainted. Okay, so I just, I get excited because I just want people to focus. And then when you turn the ship around, then you read labels, understand things, ask questions. I am 100% for that. Okay? I hope you understand what I'm saying, Gloria. Claudette, can you explain more in detail what it means by saying the thyroid is a puppet? Well, it really is, okay? And Claudette, here's what I mean by that. Your thyroid does not act independently, okay? From your brain to your ovaries, ladies, from your brain to your ovaries, your thyroid is affected by many things, okay? If you can, Claudette, listen to, okay, I think it's on our website, easy to listen. Listen to thyroid distress syndrome, because your brain, your hypothalamus is involved from the brain. Your liver's involved because that's where you convert most of your T4 to T3. Your gut is involved because, again, that's where you convert T4 to T3, about 20% of it. Your adrenals are involved because cortisol has a big effect on the thyroid. The stress affects the thyroid. And estrogen and progesterone. Estrogen disrupts the thyroid if it is in dominance compared to progesterone. So that's what I mean, okay? So from your gut, your liver, if you get fatty liver, if you're a carboholic, and you have fatty liver, that disrupts your thyroid. That is why the reset is good hormonally. And you got to lower your estrogen. Okay, we'll talk about this in a minute because there's another question about that. But that's what I mean. Your thyroid doesn't act independently. And the problem is, okay, just generally in medicine, okay, the problem is in medicine that they look at the thyroid and as an individual organ and they test it. And if it's normal in terms of blood work, then everything's good. Except that hundreds of thousands of women especially, it can happen to men, but it's mostly in women, their thyroid is sluggish. Their thyroid is not working properly because there's other factors. And, generally in medicine, they don't look at it. They look only, your thyroid numbers are normal. Yeah, but the range between in blood work is like here to eternity. And, I'm big on symptoms. Oh, I'm losing my hair, doc, and I look at food and I gain weight and my eyebrows are thinning out, my skin is dry, my nails are not, are very fragile, and, I'm sluggish and I got constipation and you name it. And those are thyroid symptoms. But, I like, in my days of practice, I would look at everything else too. From estrogen to cortisol to liver enzymes. So the thyroid is a puppet. It's got many strings attached, Marnie, and I don't mind teaching that. I don't. It's a good question because I want to repeat that. Because women fall through the cracks. Because it's complex. It's complicated. And they need to, they need to be understood. Okay? Good question. All right, let's get back here. Marnie, can or does a sodium deficiency drive insulin resistance, even with a low-carb diet? Yes. And Marnie, does it drive it? I don't think it drives it. I think it's secondary. I think insulin, look, we've often blamed salt for what sugar does, right? And I'm big on salt. I think it's a huge mistake that we've kept salt out of, people, doc, I'm eating salt-free, all because of high blood pressure, when high blood pressure primarily is a problem of sugar. It's carbs, man. That's why we see so much of it today. People become intolerant to carbohydrates. And look, I'm big on adding salt. I'm big on, add it to your water. I like Himalayan salt. A good sea salt. I like it. Why? It's got a lot of minerals in it. And, it's the chicken or the egg, Marnie. What comes first? I think what happens when you get insulin resistance, it really plays with your kidneys. And then you have your body upside down. It's excreting your salts. And people, they don't realize that, how the kidneys get affected. So I hope I'm answering your question. Look, yes, it's involved. Is it first or is it after? That's the real question, Marnie. Good question. Leslie's asking a question about insulin resistance. Are boils from insulin resistance? Well, maybe not, like you can get boils from leaky gut. Okay? Leaky gut, leaky skin. And insulin is a growth hormone. Estrogen is a growth hormone. And they can make things grow. So boils will grow. Are they actually caused by insulin resistance? In some cases. In some cases, it'll never hurt to lower your insulin. Never will hurt to get rid of high circulating insulin and insulin resistance. And that's why the reset for 30 days, it does just that. Okay? Good question. Mara, what does an overactive immune system mean? Well, it means it's hypersensitive, Mara. It means that it's getting triggered. That's what autoimmune is. It's an oversensitive immune system. Your immune system is supposed to flag viruses, bacteria, and antigens, okay? Like even for like pollen that's coming in or whatever, and your body goes, I know what that, I'm going to protect us from these foreign invaders. The problem is when it overreacts and it releases way too much histamine. Okay? You know what histamine does? It makes you sneeze. It makes your eyes water. It makes you cough. It's something to expel. Okay? That's when you think of histamine, think of expelling. Get rid of something. Okay? Like pollen or allergies or mold or, things that come in your, upper respiratory tract or whatever. And your body responds to that. You're fearfully and wonderfully made. Problem is when it overreacts to it. And these are what food sensitivities are. Okay? You're people that have food sensitivities and they're overreacting. They're hypersensitive. So they eat a certain food that doesn't bother me or doesn't bother you, but it bothers them. And that is an overreaction of the immune system. And it creates inflammation in the body. That's what happens in leaky gut a lot of times, because what happens in leaky gut is you have stuff getting into your bloodstream that doesn't belong there. The border guards are gone. And now your body overreacts to it. Okay? And that's really what it means, okay, Mara? And then you take an antihistamine, for example, like Claritin or whatever. Those are antihistamines. And but you're not really getting at the root of the issue. You're just suppressing the immune system. That's really, you're suppressing histamine. It's better to fix the problem, because I haven't seen an allergy yet. I haven't seen an autoimmune disorder yet that doesn't start in the gut. And oftentimes babies, because of the placenta, because of antibiotics. We talked about that last night in our podcast, the certain things that really disrupt the bacteria, the microbiome in the body, because your immune system is complex, but a big part of it's right beside the border between your blood and your gut. 80% of your immune system's right in there. And this is why I keep going back to gut. Make sure your gut. And look, guys, if you've had a bad gut all your life, it's not going to happen overnight. Okay? If you have a full-fledged autoimmune disease, man, now you're in a war. And the battle is going to be every day. And you just got to take care of yourself. And you got to start by fixing the gut, okay? You got to start by that. Good question, Mara. Jan, starting getting shingles, getting over shingles, sorry, and left in huge pain. Okay, and I'm trying to decide to get a shot now or wait a bit. Well, look, I'm not going to tell you that because I you know what, Jan? Now I'm getting into, I don't want to do that. When it comes to any kind of vaccine or whatever, I don't talk about it because that's up to you. That's not up to me. Okay, you're not my patient. I'm not in practice anymore. I just do, education as much as I can. But let me talk about shingles. Okay, shingles is a herpes virus. Okay, and remember, if you got the chicken pox, you got the herpes virus. Okay, now that virus is put to bed. It lays dormant. And I've never seen, I mean this, I've never seen a case of shingles. And let me just say this because somebody else asked me, hold on. Sue, you asked, can you discuss the mind-body link with illness and stress, please? Okay, so let me bring it to Jan. Okay, let's talk about the herpes virus. Okay, chickenpox. Okay, you get chickenpox as a kid. It's actually good for you. Okay? Because your body flags it and it says, okay, there's the herpes virus. I'm making immunity to it. And your body does very well. It puts it to bed. Okay? It doesn't kick it out. It doesn't kick it out of the body. Remember, a virus wants to live. And it always mutates downward. Okay? Not upward, downward. So the herpes virus sits in your body and it's sleeping. It's like a bear all winter. Okay? It's in hibernation. Okay. And it can wake up. But here's how it wakes up. The body-mind. Because what happens, and I've never seen an exception to this when it comes to shingles. Okay? Shingles always comes in a high stress situation. It's like a cold sore, which is the herpes virus, okay? Herpes simplex, herpes zoster, okay? Simplex is cold sore, okay? And people get a cold sore. Why, doc, why did I get a cold sore? Well, you must have been under stress. And look, you can stress yourself out even by bad eating. But generally, there's cortisol involved. Cortisol is, okay, that's cortisol. If you're wondering what cortisol is, it's like that over a period of time. Again, it's the fight or flight. Somebody scares you, you want the fight or flight. You're going to punch or you're going to run. Okay? And that's, your body's unbelievable. It's fearfully, and God gave you that, okay? But it's not meant to always be secreted. So when cortisol is secreted over a long period of time, relationships, you got somebody sick in your family, or, bad relationships or financial, worrying and blah, blah, blah. You can't sleep and your cortisol's high. And you can't sleep and your cortisol gets higher. And, there's a huge connection. A huge connection. And that suppresses the immune system because, think about it. If you're running away from a bear, do you think your immune system is worried about a virus or a bacteria? Nah. It's a diversion. And when I wrote my books on chronic fatigue syndrome, okay, boy, oh boy, that was a main thing. That's where I became like a real woman's doctor. Because I studied chronic fatigue. It was part of my PhD. I was one of the first guys to say chronic fatigue syndrome is a stress-related syndrome. It's high cortisol. It's the burnout of the adrenal glands. Two little chestnut glands on top of the kidneys. Adrenal on top of kidneys. And it created a cascade of symptoms, including, because you see, in those days, I remember doing a radio show. Must have been in the late 80s or 90s. Yeah, they were asking me about chronic fatigue. And they said, well, Doc, isn't that the Epstein-Barr virus? I said, nah, it's not a virus. A virus is just, maybe the straw that breaks the camel's back. But it started way before that with stress. And I wrote a book about the modern woman because it was different. Like my mom had 11 kids. Like we think about that today, and my mother was a hero. Like she had 11 kids. How did she do that? But it isn't like my mom didn't have stress like people have today. It comes from the environment. It comes from sugars. It comes from, like, the world's changed, guys. And then we have so much more shingles, did you know that, than we ever did? Not that shingles been around a long time. But today, like shingles, and that's why they came out with a vaccine for shingles. Because we see so much shingles. But why are we seeing so much shingles? Because of stress. Stress is different than it used to be. Not that people weren't stressed, of course they were. But today it's everything. It's compounded. It's like compounding interest. You ever owe money on your credit card? It compounds daily, okay? And this is what's, now you get a hyper sensitive system, and now you can get shingles, and it's, like I say, very common. Or like other viruses that take over the body. It's not the virus. It's the immune system that's suppressed by the stress, okay? Jan? Jan to Jean. Jean or Jan? What would cause a healthy person to get a blood clot in the lung? Well, usually no surgery. Well, look, that usually comes from deep vein thrombosis in the leg. Healthy person can get that. Sitting too long. Okay? It's usually a deep vein thrombosis. And it can travel from the leg to the lungs. That's how usually it happens. And that can kill you. And a lot of it is, it occurs with people healthy as horses, and they travel, and they're 10 hours in an airplane or sitting all the time at their job. We're very sedentary today. And, that really makes us much more. And here's another one I'm going to tell you, and, people will argue with me. One of the biggest things in where you get blood clots is people are dehydrated. Remember, you got 60,000 miles of blood vessels, and a lot of people have thick blood, like molasses, and that's because they won't drink water. They'll drink anything else, but they won't drink water. That makes you more susceptible, okay? Very, very good question, Jean or Jean. Debbie, does getting your tubes tied affect your hormones? Yeah. Yes, of course. It does play with your estrogen and your progesterone. But remember, you're even with your tubes tied, you're still, your body adapts. Okay, it adapts, and it's like a man getting a vasectomy, okay? Does it affect them? Yeah. It's not really normal. It's surgery. But the body adapts, okay? But it can play with your hormones. For sure it can, okay? Sue, I answered your question. Okay, Anna's asking a question. My friend had a blockage in her stomach, turned to infection and traveled to her brain and passed away. Why would this happen? Well, she got a condition, and God bless her. She got a condition, sepsis. You get an infection, and it gets into your bloodstream. That's what happens. Sepsis is the infection went from an organ to the bloodstream and can be very deadly. Very deadly. And, that's what happened. Okay. It got into the blood and it traveled to the brain. And that's what sepsis can do. It'll shut your body down. And can be very, very deadly. I've seen it after sepsis. I've seen it after bowel blockage. Sepsis can happen, in many different ways. And it's you can get a cut on your finger in people that have, an infection, a small infection, and then they get a super bug in there or whatever, and that can kill you. So that's what happens. Anna, good question. Hella, what does Dr. Martin think of ozone therapy? Well, I'm not against it. Okay, it was never my specialty, but certainly I like it. Seems to have some good studies behind it, and I got no problem with it. Okay. Ann, I would like to know what's the best vitamin C. Now, Ann, you set me up. The best vitamin C. And guys, I mean it. Okay? I mean it. I'm not joking. The best vitamin C I don't have much left. I have my coffee cup. Okay? I have my coffee cup. And vitamin C, the best vitamin C is coffee. True story. It's real. And 1,000 phytonutrients in coffee. 1,000. Vitamin C, ascorbic acid. Okay? Coffee has it. And then 999 other things. What's better? Vitamin C in a capsule? And you get vitamin C if you eat an orange. You have an apple. There's vitamin C in it. Okay? Am I against that? No. I'm just telling you that the real vitamin C is coffee. Okay? It's coffee. I put the acerola cherry. I like that in vitamin C. We put it in our Navitol, vitamin C. Because that vitamin C with the Navitol becomes much more bioavailable. Your body takes it up. Problem with a water-soluble vitamin like C, like ascorbic acid, it's got a very short time in your life, in your body. It doesn't last long because it's not that bioavailable. That's why drinking coffee, guys, and I mean it, is better for you. I'm telling you. Okay? Okay, Ann? Wendy. Well, again, talking about vitamins. Liposomal, okay? Liposomal vitamins. Really, are they better for you? The question Wendy is asking. It's claiming to be more absorbable. Well, listen. That's how, in some pharmaceuticals, that's what they do. They put it in a lipid, and for the body to absorb it. Yeah, I like that. I like that. I don't think that's wrong. In a liposomal format, I like it. Have it with peanut butter. And you got liposomal. Liposomal means fat. That's why I like my little peanut butter with my supplements, okay? Somebody asked me the other day, Dr. Martin, why do you like peanut butter? Because I do. I didn't say it was good for you. I just like it. Okay? I do. I like peanut butter. I've always liked peanut butter. Somebody said the other day, I just got to say this in passing, like the EMC, okay, the reset, eggs, meat, and cheese. Oh, doc, there's no variety. Well, gee, I don't know. I've been eating the same stuff for the last, I'm going to be 70 very shortly. Okay? I've been eating peanut butter since I was a kid. I've been drinking coffee since I'm, 15 or 16? I don't get tired of that. I've been eating bacon and eggs since I'm a little wee at the height of a grasshopper. I'm not tired of it. I just had some bacon this morning. Better than olive oil. No, I'm not tired of bacon. You? I'm not tired of it. I'm not tired of eggs. How do you like them? Scrambled? Yeah. Sunny side up? Yeah. In an omelet? Yeah. Poached? Yeah. I'm not tired of it. Why would you get tired of it if you like it? Okay. Mary, what does Dr. Martin think of glutathione? Well, I like glutathione. I talk about it all the time. Your body makes glutathione. Okay? So, I love it. Supplement. Navitol elevates your glutathione. Keep your liver clean, and your glutathione is like Velcro. It attaches to garbage. It attaches itself to heavy metals. It attaches itself to things that don't belong in your body and will take it out of there. It's like Velcro. I love glutathione. But remember, your body makes it. And the problem with any supplement of glutathione is that, your body don't take it in very well. It's not really bioavailable. But I love glutathione. That's why I love Navitol, because it elevates your glutathione. So does probiotics. Okay? Now, Debbie. Okay, now you're getting into women's issues. Well, we've been talking a lot about women's issues today, Debbie. I'm wondering, Dr. Martin thinks, which is better, the Mirena IUD or the new Nexplanon? I think I said it right, Nexplanon. Nexplanon is just a little device that you put in your arm, right? And it's secreting hormones. You got to be careful with it, okay? Because it really makes you much more susceptible to blood clots. If you're going to take Nexplanon, okay, be careful with it. And I would tell you to take Navitol with it because it'll protect your endothelial levels, layer of your blood vessel. Endothelial, okay, what is that? That is the Teflon layer in your blood vessels. That's where you get blood clots. That's how it gets damaged. And that's one of the things with this new IUD. It's not an IUD because it's on your arm, I believe they put it. Well, I don't know. I'm not a woman. But the Mirena IUD gives you progesterone. I think I liked it to some extent better than the birth control pill. The problem is there's a lot of side effects with that too. It's a device put right into your body. But listen, guys, I understand, I understand a lot of women who had such bad periods and they, their menses and the doctor put in the Mirena for the progesterone. But always protect your body from the side effects of that, okay? Always protect your body. That's why I'm big, because blood clots and, when you put a device in the body like that, okay? Be very, very careful with it. But, again, I'm not telling people not to get, women not to get these devices, okay? I'm not. But protect yourself. Okay, guys, I think I got them all. I'm pretty sure. Let me just go look. And yep, that was it. I think I answered every one. I hope I did. I think I did. Okay. So, guys, thank you very much. We appreciate it. We appreciate you guys. Martin Clinic Facebook group. Are you a member? Please. Come and join us, okay? I'm inviting you. And we love you. We love that group, and we love the comments, and we love the questions, and we love all of that. What a great group. And get your friends listening to the Doctor Is In podcast, okay? There's new podcasts up there. Every week, we put new podcasts. These things that I'm doing live become podcasts. And it's a good tool to re-listen, but you can get people to download them on their smartphone. The Doctor Is In podcast. Okay, guys, we love you dearly. Talk to you soon.